Alright, um, just finished dinner, took a little break. Let's get it rolling. Um, I kind of want to finish the rest and by 9:30, and we can start taking the exam um, till like 10:30, and then we can go sleep and start again tomorrow because we're a little late on schedule. But let's get it going. Come on, cardiac tamponade. Cardiac tamponade. Okay, so liquid in the pericardium, decrease CO, cardiac output, or non-jugular distension as symptom. Treat with pericardicentesis. Okay, so pericarditis is, yeah, let's talk about pericarditis first. Heart failure, myocardial infarction, uh, valvular hypertension, peripheral artery disease, coronary, that's cardiac surgery. So let's look at if there's any. This is hematology. Okay. Cardiovascular disease, angina's myocardial infarction, heart failures here, valvular disorders, aortic aneurysm. Aneurysm is just like when there's like a distension. Um, Hypertension, and that's all it talks about. And then, and the peripheral artery disease, peripheral venous disease, venous thromboembolism, VTE. Also, it can be a deep vein thrombosis that can lead to a PE, varicose veins, Berger's disease, arteries, lower extremity, pelvis occlusion, Raynaud's syndrome. Okay, so there's nothing about pericarditis and endocarditis. We'll just have to go through it based off of what we know. But we can do Beck's triad versus Cushing's triad first. What causes? Oh, Beck's triad is cardiac tamponade. Alright, so, and then Cushing's triad, you can see in strokes, or not in strokes, yeah, in strokes, actually. Um, what else causes Cushing's triad? Cushing's triad is caused by strokes. Yeah. Intracranial or increased intracranial pressure causes Cushing's triad. Beck's triad is caused by the heart. So hypotension, muffled heart sounds. Okay. So why don't we talk about pericarditis first? So we can talk about cardiac tamponade, and then Beck's triad, hypotension, jugular vein distension, and tachycardia. see. Alright, regular expiration. Low blood pressure, hypertension, muffled heart sounds. And we're gonna also have tachycardia. Shortness of breath. Yep. Okay.
Rapidly.
Hey Google, stop.
It compresses all
Stopping chocolate.
Cardiac tamponade is a life-threatening condition characterized by the accumulation of pericardial fluid in the pericardial space. The pericardium is layers which envelope the heart. When fluid increases in the pericardium rapidly, it compresses all heart chambers in that it will impair venous return to the heart. Essentially, filling of the heart is decreased, resulting in a reduced cardiac output, and in later stages, obstructive shock. Let us learn about the anatomy and function of the normal pericardium. Here is a normal chest x-ray, and here sits the heart. A layer known as the sac can also, it is called a pericardial effusion. Organisms, be it bacteria or viruses, can also cause inflammation of the pericardium, pericardial effusion. Radiotherapy, as in radiation, can also damage the pericardium, causing lupus erythematosus and cardiothoracic surgery, such as a coronary artery bypass procedure. Certain medications can also how fast the fluid accumulates. Here's a chest x-ray of the same, including the two ventricles. It gets pushed back. In this area, because of all that fluid,
you're going to have decreased cardiac output, you're going to have dyspnea, you're going to have hypotension because there's not a lot of blood pumping out, tachycardia, jugular vein distension due to the edema, and then you're going to have muffled
fluid around the heart sounds are muffled. Cardiac output is equal to contractility, venous pressure, low. Claude Beck actually described a second triad for chronic tamponade, which involves ascites. If really seen, proximal distend, filling to the right side of the heart, very interesting and an important clinical examination finding. Cosmal sign is present when, during inspiration, decrease in cardiac output based on this simple equation. The most important clinical manifestation of cardiac tamponade is a triad of distended jugular venous pressure, low blood pressure, and muffled heart sounds. This triad is called Beck's triad, first described by Claude Beck in the 1930s, and it was specifically used to describe acute cardiac tamponade. Claude is usually pulse right, and this is because intrathoracic pressure decreases, the bulge of the creases and diastole, compared to expiration. In cardiac tamponade, there is restriction in ventricular filling. With inspiration, there is significant ventricular septal bulge to the left, increasing for someone with a grossly enlarged intent, and the electrical activity that is received. It will show some paradoxus is when this change is more than 10 millimeters mercury. Investigations that can be ordered for someone with a cardiac effusion or tamponade include chest x-ray, which we have seen. The heart is obviously grossly enlarged in tamponade. ECG will show something called electrical alterans, which is alternating waveforms. The QRS is big and small, and this is due to the pericardial fluid encasing the heart and the electrical activity that is received by the ECG during this measurement. Pericardial effusion and the blood test to an autoimmune screen. Emergency after
sac that surrounds the heart and the roots of the great vessels, cushioning them and preventing friction during each heartbeat. Let's start with a bit of physiology. The pericardium has two layers, an inner serous fluid that is secreted by Staphylococcus aureus, as well as fungi like Histoplasma capsulatum and Candida species. On the other hand, non-infectious causes of pericarditis include Dressler syndrome, also known as post-myocardial infarction syndrome, which is an immune response triggered by antigens released by dying heart cells and occurs several weeks after myocardial infarction. Another non-infectious cause of pericarditis is uremia, which is when blood levels of urea get really high, usually due to kidney failure. The high levels of urea irritate the visceral pericardium cells, leading them to secrete a thick pericardial fluid that's full of fibrin strands and white blood cells. Pericarditis can also be caused by autoimmune diseases, such as systemic lupus erythematosus, rheumatoid arthritis, or scleroderma. Finally, other causes of pericarditis include cancer and radiation therapy to the chest, as well as severe hypothyroidism and certain medications like penicillin, procainamide, and hydralazine. Now, pathology-wise, with pericarditis, the pericardial layers are infiltrated by immune cells and fluid. As a result, these layers become inflamed, thicker, and boggier. Think about how a piece of dry, flat pasta gets cooked and thickens up as it soaks up fluid. This makes the layers rub against each other, which allows out of the vessels and into when there's blood in it, or purulent if there's pus in it. And this depends on the cause of pericarditis. Additionally, if the pericardial effusion grows or worsens quickly, it can put pressure on the heart itself, preventing it from fully stretching out or relaxing between contractions. This can cause cardiac tamponade, where the heart can't fill up or pump blood properly, which is a medical emergency. On the other hand, in clients with chronic pericarditis, the visceral pericardium gradually becomes more and more fibrous, forming a over time, this can lead to heart failure, which is where the heart is unary and stable. This pain can radiate to the neck, shoulders, and back. And with if cardium when beating. Some tension rub, which is a scratchy, grating, high-pitched rub rubbed on wood. Additionally, complications come with their own signs and symptoms. For example, with heart failure, there could be hypotension on account of decreased cardiac output. And with
Okay. So let's do pericarditis first. So first of all, is an infection of the pericardium. I think we should know that by now. Right, it's associated, so its cause is post-MI, and it was talking about,
which is where the heart is unable to pump enough blood to meet the body's requirements.
it's talking about it here.
An immune response. The pericarditis, less frequent capsulatum and syndrome,
So
also known as
virus.
post-myocardial failure. The high levels of urea irritate the visceral pericardium.
Kidney infection. So post-MI, myocardial infarction, we can have like bacterial infection, and also
Pericardium cells. Pericardium to secrete a thick pericardial fluid that's full of fibrin strands and white blood cells.
kidney failure.
Pericarditis can also be caused by autoimmune diseases such as systemic lupus erythematosus, rheumatoid arthritis, or scleroderma. Finally,
Lupus.
other causes of pericarditis include cancer and radiation therapy.
Rheumatoid arthritis. I did not know about that.
Now, pathology. Being it from fully stretching or this increases the pulmonary blood pressure. Observe them to see if they're taking shallow breaths to avoid chest. Clients with pericardial effusion or STEMI, in which case the tension, where the jugular vein in the neck becomes enlarged and distended. Some clients can develop pulmonary edema, which typically presents with dyspnea and crackles, as well as peripheral edema, causing the limbs to swell.
So some signs and symptoms we can have, let's see, like chest pain,
And chills, amongst others. Additionally, complications come with their own signs and symptoms. For example, with heart failure, there could be hypotension on account of decreased cardiac output as a mercury state ended. Some clients can develop pulmonary edema, which typically presents red ST segment elevation, meaning the ST segment is elevated in almost all leads, along with PR segment depression. An important element is to distinguish these findings from an ST elevation myocardial infarction, or STEMI, in which case the ST elevation is typically localized in 2 or 3 leads. Additional diagnostic tests include laboratory tests, which can reveal an elevated white blood cell count, as well as an increased ESR and CRP. On echocardiogram, a pericardial effusion makes the heart look like it's dancing within the pericardium, whereas chronic pericarditis shows the stiff serous pericardium restricting the heart's movement. With a large pericardial effusion, an X-ray can show the excess fluid pooling at the bottom of the heart, giving a classic water bottle sign. In clients with pericardial effusion, pericardiocentesis can be done to obtain and analyze the pericardial fluid, which can show elevated WBCs or the presence of bacteria or fungi depending on the cause. Finally, with constrictive pericarditis, a CT scan can be performed, which can reveal pericardial thickening and calcification. In terms of treatment, the main goal is to address the underlying cause when possible, as well as reducing pericardial inflammation and pain by prescribing medications like NSAIDs or colchicine. In clients with contraindications to NSAIDs, corticosteroids can be used. In addition, clients with pericardial effusion can require pericardial drainage, which is done by inserting a catheter into the pericardial space. In clients with recurrent pericarditis, a last resort measure is to perform a pericardiectomy, which is the surgical removal of all or part of the pericardium. Alright, now let's look at the nursing measure is to perform a pericardiectomy, which is the surgical removal of all or part of the managing your client's pain and monitoring for complications. To begin, ask your client to describe their chest pain. Forward. Also, agrees and colchicine or steroids as prescribed to decrease pain and inflammation. Next, monitor your client's vital signs and assess their cardiac output. Then, assess your client for signs of pulsus paradoxus, and review their ECG for any changes in pulsus paradoxus, jugular venous distension, muffled heart sounds, a narrowing pulse pressure, tachycardia, tachypnea, or hypotension. Increase the IV flow rate and stand by to assist with a pericardiocentesis. Around the heart, and that causes chest pain. Blood and stress. Advise them to notify their healthcare provider. Causes include Dressler syndrome, uremia, autoimmune virus, and less frequently a bacteria or fungus. Or taking a deep breath and improve neck and shoulders. Pericarditis typically present with signs of diagnosis. Client can also experience fever, chills, and fatigue. On the other hand, clients with chronic pericarditis typically present normal lab work like an elevated when glucocorticoids. Clients with an effusion can require pericardial drainage, and when this is unsuccessful, aims to alleviate the healthcare provider. Thrive. Learn. Shortness of their level of activity can prevent further in front of them so they can lean forward depending on the cause. In addition, clients with recurrent pericarditis, a last resort measure is to perform a pericardiectomy, which is the surgery.
We got NSAIDs. We got colchicine. And then we got corticosteroids. That's pericarditis.
Surgical removal of all or part of the pericardium.
All right, how are you feeling today?
Endocarditis today. So we're going to talk about it. So got endocarditis from Jane, although it's not contagious. So from Jane, F stands for fevers. From R stands for rot spots. Just think of the eye exam. O stands for Osler nodes. So I think of ow, Osler. Ow being because they're painful or tender. M is murmur, so heart murmur. Jane, so Jane, Jane is Janeway lesions. And I think, oh, just Janeway, meaning, oh, just, they're not painful, they're just Janeway lesions. So they're distinct from the Osler nodes, which are ow, Osler. A for anemia, N for nail bed hemorrhages. So I'm showing my nails, but nail bed or splinter hemorrhages are sometimes called, and E for emboli. So sometimes you'll see embolic phenomenon on a CT scan or MRI or something like that. And that's often evidence, again, of something that's kind of spewing off of your valve and kind of. And for diagnosis, you really want to, there's Duke's criteria, and many of the things that I just went over are part of Duke's criteria, specifically minor criteria. But for the major criteria, the big things you want to think about are two: blood cultures and echo. So the blood cultures, basically get large volume blood cultures, you see if anything grows out. Typically, it's going to be something like Staph aureus or Staph epi or enterococci or streptococci. So those are your most common organisms. There are some very uncommon organisms that are very uncommon, but you should kind of keep a lookout for. Coxiella being one of them that often kind of people will out looking at, and that would be like, endocarditis. Simply as any evidence of dehiscence, then you want to make sure that you would investigate for endocarditis. So those are the keys. So if there's any evidence of dehiscence, then classically, or if you're thinking about vancomycin, it might be vancomycin because surgical replacement done. And prosthetic, so just surgery. The key there is just length of treatment. You end up giving antibiotics for weeks and weeks, as opposed to, let's say, a UTI or something where you give it for maybe 3 days or 5 days. With a biofilm infection, usually will die. Endocarditis. So that's
Okay. Let's do endocarditis.
something like Staph aureus, MRI, or nail bed. The way it's moving is a little bit more stiff, or that. Next, let's move down to diagnosis. And for diagnosis, you really want to, there's Duke's criteria, and many of the things that I just went over are part of Duke's criteria, specifically minor criteria. But for the major criteria, the big things you want to think about are two: blood cultures and echo. So the called an E for emboli. So sometimes you'll see embolic phenomenon on
Diastolic. No, diastolic. Systolic. Okay. Um, I know my S1 with S2s. They're Hearthstones. S3 is actually is S3 normal? I think S S3 is normal for like athletes, children, obviously sign of disease. Yeah, but S1 and S2 is normal, and then S4 is like right before S1, and then EKGs. Um, well, let's look at EKGs. We have 7 minutes to look at EKGs. Okay, before we look at EKGs, let's take a look. Hypertension. It can be primary, secondary. It's mostly primary actually. Headaches, fatigue, dyspnea. Lots of drugs, furosemide, loop diuretic, replace potassium, spironolactone. Look at potassium, also diuretic. That's a potassium-sparing diuretic, actually. Propranolol is a beta blocker. Can cause bronchospasm. Can cause mass hypoglycemia. Can cause bradycardia. Decreased contractility, decreased heart rate. Clonidine, alpha blockers. Lisinopril, ACE inhib, angioedema, dry cough, hyperkalemia. Nifedipine, verapamil, these are calcium channel blockers. Look for no theophylline, no digoxin with verapamil specifically. Angina, nitroglycerin, do not take it with anything that ends with afil, because afil are drugs that are for erectile dysfunction. For angina, look for Mona, like Mona Lisa angina. Mona Lisa, so morphine, oxygen, nitroglycerin, aspirin. Also ACE, statins. Yeah, pulmonary artery disease. It can cause like myocardial infarctions. It can cause um, uh, angina, stable angina, unstable angina. Um, and then with heart attack, markers are increased troponin, more increased ST segment, and that's a ST. It's completely occluded. That's why it's ST elevated. Amiodarone, antidysrhythmias. Morphine, again, that Mona, um, uh, morphine, nitroglycerin, metoprolol, nifedipine, verapamil, again, verapamil, no nifedipine, verapamil, no theophylline, and no digoxin. Heart failure, just your normal heart failure. Depending on the side, you can have different stuff. Elevated BNP is a indicator of, or at least prolonged elevation of BNP is an indicator. Heart failure, you want furosemide or diuretics, digoxin, calcium channel blockers, ACE inhibs, ARBs. Endocarditis, basically it's like a infection inside the endocardium. Um, Antibiotics most of the time it's a longer period of time, not like 3 to 5 days with like UTI. Blood cultures, echocardiogram, peripheral artery disease, basically, you know, pericarditis post MI. It can cause cardiac tamponade, um, and which is an emergency. And then signs of cardiac tamponade is jugular vein distension, muffled heart sounds, and also decrease in blood pressure. That's different from Cushing's triad, which is um, bradycardia, decreased blood pressure, and irregular respiration. Right? Yeah, regular widened pulse pressure, bradycardia, and irregular respiration. Um, and that's with stroke, and that's with neuro. So Cushing's is with neuro. Beck is with heart. It's Beck. Beck is like a girl. Girl loves hearts. Um, Beck's triad. Yeah, and then some definitions. Preload is the pressure from inside the heart at the time of diastole, like the pressure going out, and preload or afterload is the pressure preventing, is the pressure going against the preload. So preload is trying to go out, afterload is trying to push things in, and so preload, afterload minus preload is the amount of pressure going out. That determines your blood pressure. Cardiac output is stroke volume, which is the amount of blood. So diastolic, um, diastolic volume um, minus and systolic volume. And diastolic is when the heart is fully expanded, ready to pump, and end systolic is by the end of the squeeze, and that's the cardiac out. That's the stroke volume times the heart rate is the cardiac output. Cardiac output is just the um, amount of pump each time multiplied by uh, by the heart rate, which is the rate of the pump going. Some labs, HDL to LDL is that 1:3 ratio. HDL being above 50, or like, yeah, above 50, and HDL being below 150. Usually want it around that range. That's a very rough range. Total cholesterol less than 200. Um, some things that I really want to highlight is the ST. I really want to highlight the whole angina, Mona part. I really want to know the pericarditis. Okay. EKG practices. I really want to take a quiz, but I don't think right now is a good idea because it's late and I'm probably not going to do that well. By the time I finish, it's going to be like 11, so I kind of want to wait until tomorrow. Physician, nurse practitioner. We just need like a RN practice. We can do like 30 questions, I think, actually. This is normal sinus rhythm. This is okay. Basic. Okay. So they have a negative charge. Process that causes heart cells to contract is called depolarization. Alright, I guess that's called repolarization. Which part? The upper SSA. They travel next to the bundle of his. Wait, dude, I just like EKG strip. Okay, so this is normal sinus rhythm. This is here. Actually, I have a page for parts. Okay, so normal sinus rhythm. That is tachycardia. That is bradycardia. That's AFib, premature ventricular contraction. Yeah. That is VTAC. That is asystole. Ventricular tachycardia. Ventricular tachycardia. Hold on. What is number 8? Oh, this is VFib. It's not tachy. This is ventricular fibrillation. I actually like this song a lot. Okay. VTAC looks like a V. This is, I don't know what that. We don't even know what that is. So I'm just looking at this book. I know tachy. I know normal. I know Brady. I know AFib. It's like the flutter. And I know VTAC, and that's just VFib. Cool. So we're done with EKGs. Let's do 30 questions today. I'll take about 30 minutes. I'll just go until 10. Scheduled too much today. I should not have scheduled that much. So all subjects, all systems. Let's do 30 today. I'll do 35 questions. Partial hearing loss, effective communication. Which following action? Partial, no. Yes. Ensure hearing aids are properly applied. Provide written information, supplement. Raise voice, no. The client is okay. Hands and feet making cooing sounds. Infant smiles and laugh appropriately when caregivers provides toy. No evidence of moral tonic or moving reflection noted. However, 4 months. The infant is weak, muscle tone, and neck does not hold up. That should not be the case. Uh, I remember, like, at 6 months they should be able to hold their position. Hold head when prone. So smiles in response to smiling and talking. Tracks caregiver with eyes at 4 months old. 6 months old, put object in mouth. So 2 months old, gain head control when held, place object, place in the hand, makes cooing sounds. Begins to laugh, makes some consonant sounds at 6 months. 9 months can sit up, babble, mama, dada. At 1 year old, you should be able to stand. So at 6 months old, okay. So let's do like 6 and 12. At 6, you can roll, lateral, pose. So you can roll, sit, can you crawl? Put objects in mouth. So when I think of a baby, I think of them like sitting there with like a toy, putting in the mouth. So that's like a 6 months old. Making consonant sounds. Cool. Parent calls after hours triage about 3-year-old who is sick with the flu. Report necessitate acetaminophen. I don't know what that is. Ibuprofen given 6 hours for body ache. Popsicle, gelatin dessert, acetaminophen for fever. I think that's pretty important. What is that? Oh, I did not know what that is. Oh, necessitate an intervention. Okay, I would have been like, these are fun. Sufficient fluid support. Water offer possible gelatin is a palpable means getting children just. Okay, so that is the same class as aspirin, and we don't give that because that gives Reye syndrome. I don't really know what Reye syndrome is. I'll be honest here. Let's search it up. Reye syndrome. Very serious swelling of brain and liver damage. Shit. Okay, so no aspirin, which means whatever that is also no. B something S something B S something. Cool. Nutrition practice of young children. Snack for toddler. Toddler. Raw carrot sticks. Okay, carrot. I don't like the word raw. If it's just carrot sticks, then sure. Toddler, half cup of juice is a little much. I want to say carrots. Fuck. Small hearty stick foods. Post choking hazard. Okay. Protein, empty calories, sugars. So although orange juice source vitamin B probably should have no more than 4 to 6 ounces per day. Half a cup is 4 ounces. Sweet cereals except marked towards high in sugar, dry sweet sugar. No, raw carrots, hard choking hazard. Whole wheat crap, banana slices, yogurt, cooked vegetable. Cool. Has disclosed healthcare provider bedside procedure moderation. Okay. Open the airway with head tilt. What? That is BS. Okay, I guess airway breathing is done, so it's just circulation. So check for pulse ox. Okay. Okay. If they can talk, they're fine. The charge nurse in the emergency department assigned officer which client is most appropriate. No. Upper respiratory tract infection peak expiration value is 45% of personal best. Antibiotic 3 days ago, acute negative. I think. What the heck? Okay. Just beyond drug rash, experiencing antibiotic allergic reaction, peak flow meter lung severely reduced. I agree, that's severely reduced. I did not click that. A seizure associated with febrile, irritable, have underlying serious meningitis. Okay, I agree. The seizure was not fine. Fractured clavicle is not uncommon. Treat conservatively, new nursery perform basic skills. It's also a 2 out of 10. I agree with this actually. Emergency with a severe throat of 102 is drooling. Okay. Um, uh, tripod position and then intubation. Healthcare providers screaming at nurse, why didn't you get the surgery scheduled sooner? I'm so sorry, I'll get it fixed and scheduled. A lot of location advising. I think you're overreacting. You should specify that. I delegated this task to Leslie. Please follow up with it. Why didn't you get that surgery scheduled sooner? Please excuse me while I locate your my supervisor. I think that's the correct response. The nurse teaches the client about avorvastatin. Okay, experience symptoms associated with serious Oh, I think it's muscle aches. Oh. Isn't it muscle aches? Okay. I don't know what happened. I just remember there was something about myopathy. There we go. Okay, so these are done. Let's write these down. Myopathy. That's a part of today. Statins. Where's my statins? Statins are they're prescribed for. Where are my statins? Angina. Okay. So this can cause um myopathy. And also increase CK, creatine kinase. This is very important information. I was like numbness of feet, but no. I want to say muscle, because numbness of feet neuropathy is okay. Let me order. Okay. Neck cancer develop mouth storage with external radiation therapy. Okay, apply water soluble lubricating, moisturize. Brush teeth is soft. Cleanse mouth, saline after meal and bedtimes. Yeah, remove denture between meals and soak in clean solution. Rinse alcohol-based antiseptic mouthwash to decrease mouth odor. It's alcohol mouthwash. Oh, oh, you don't do that. Okay. I was like, oh, they're irritating. There's this rheumatoid arthritis. Consider the therapy. Uh, naproxen. That's okay. Just kidding. I'm taking antibiotics for UTI. So they are TNF inhibitors, tumor necrosis factor inhibitors, suppresses immune system due to immunosuppressive action, decrease. I actually should have guessed with these two answers. Stroke. I just learned about that yesterday. Approach the client with visual impairment from the affected side. No. Just by dawning. receptive aphasia. Left. Right side is stroke. Right side is not. What? Right? Wait. Right, left, right side is stroke. You're not gonna have impulsive behaviors. Verbal prevention. Unaffected side. Right-sided. Yeah. What do you mean? Ration. Emotional thought. Okay, sure. Um, okay, so instruct the client unilaterally dawning, so affected first, and then the unaffected. Because you have receptive aphasia, you want to use gestures. Teach left to turn their heads. Yep. Teach families, client, right-sided, stroke, affect, impulse. Yes. Okay. Right and wrong. Right side is in charge of right and wrong impulse control. Same with the frontal lobe, but sure. Alzheimer's. Redirect as you say asking. Propel. Yeah. That's an adult violation of gender. They still do questions on the computer. Fuck. I was like, man. Really? Really? Yeah, you can't ask for that. They can measure, but they can't. Let's be part of his judgment. Measure the client's stocking. Yes, they can't do that. I've gone to psychiatric emergency department of ambulance manager situation. an attack moves on a mission to find and kill them. And so when you're going expressively swash on seems to care about activities and examination of lawyers. This huge and last video apparently voice being schizophrenic. War findings for immediate follow-up. I just want to know which ones are selectable. I don't want to say that. I think Oh, thank you. Enlightenment, hyperthermia. What? What am I gonna learn? I remember learning about enlightenment, hyperthermia. Oh. So this is it. Skeletal muscle. Just like that today. Um. Yeah. Yeah. Side effect. Nitroglycerin headache. Dizzy and lightheadedness, profound hypotension. Have make your squeeze fall. Oh god. Ciprofloxacin. Lisinopril. Lisinopril does not. Lisinopril the Piperpanol. That is contraindicated because it can cause bronchospasm. The Cinepro dry cough has no hyperkalemia, teratogenic, ibuprofen, asthma, it's okay. Ciprofloxacin, that's not a penicillin, right? Ciprofloxacin is not a penicillin. I'm gonna guess this one. Fuck. That's a what? Ciprofloxacin. Okay. Nasal. Okay, I know that was real. I know that was true. I know that. Nice. Hypertension. Beta blockers. Beta. Okay, yeah. NSAID. It's an NSAID. Yeah, ibuprofen, NSAID. Aspirin. It is aspirin. Asthma. Oh, okay. Okay. I did not know that. And because of cells. The Bella Tato is not immune. 12 weeks gestation. Oh. Postpartum. MMR is a live vaccine. There's a couple live actually. MMR, varicella. Severe features. No prognosis include teaching for common and blood sugar alcohol report failures. Yeah. Yes. Visual change. Yes. No prevented. Preeclampsia without severe features. Likely be induced as soon as you reach term gestation or before if severe symptoms. That is true. Frequent monitor of your blood pressure at home. Report increasingly. Yes. Perform fetal. I don't think those are true. Oh, what? Notify healthcare provider immediately if you notice any vaginal bleeding. I did not know that. Okay, report. Yes. Or liver damage, placental, bro. The nurse is caring for a client with stroke due to receptive aphasia. So I don't understand. You need to speak it loudly. Oh, serotonin syndrome. Did not see that coming. Okay, I agree. Diarrhea and fever for 2 days. I always had another question I really want to. What was it? Ibuprofen. Aspirin and asthma do not mesh well together. Originally, I'll need one. I'm not sure what this is, so I'm going to say that's true. That is false. Maybe? Yeah. I don't know if that's true. Oh, look at me. I guessed my ass out of that one. Cardiomyopathy as a rhythm she'll exhibit. Okay. That's VTAC. Well, we already know they're tachycardia. Initiate. I think we're going to defibrillate to restart the heart. Assess the kind of heart. Yeah, I said VTAC. Pulses or habit pulse. Oh. Yeah. Yeah. Let's see how well I did. I got like 50%. 69. Oh, that's pretty good. Alright. That's it today.